All right, so the next technique I'm going to show is going to be for knee pain and osteoarthritis. This is going to be hip joint manipulations. So in this study, they actually had 5 criteria for what's going to be the what will be the best to help with knee pain and osteoarthritis. So the first one is going to be hip flexion, passive range of motion less than 122 degrees. It's also going to be hip internal rotation, passive range of motion less than 17 degrees. It's going to be pain with hip distraction. It's going to be anterior thigh pain, and it's going to be pain or paresthesia at the hip or groin region. So the first one I'm going to show is going to be a caudal glide. The patient will be lying supine. I will use a mobilization belt for this, and for this to work with one variable, it's going to be 92% successful rate within 48 hours. And with the 2 variables from the criteria, it's actually 97% successful rate within 48 hours. So I will use this mobilization belt, and I will put this around me. And I will do the affected side of this patient here. And so what I'll have the patient do is I'll have the patient bend his leg here, and then I will put this through. And I will want to get this as close to the joint line as possible for this patient. I will put this around my hips here. And so then what I will do is I will then take the patient's leg and I will have it supported here. And I will push in my hands this direction towards the head, but I will also give a pull on the belt back towards the patient's feet here. And I will give grades 1 and 2 to control pain and edema, and 3 and 4 to increase range of motion. So that's going to be for the caudal glide with a belt. The next one I will do is anterior posterior glide. That's going to be with the patient still lying supine, but I will take the patient's leg and I will cross it over. And then I will come and I will give a posterior glide. I want to make sure keep my hands on the outside of the kneecap so I don't give any pressure for there. And I will push down, posterior anterior, anterior posterior glides, and I'll do the same grades 1 and 2 to control pain and edema, and grades 3 and 4 to increase range of motion. And then lastly, I will do is going to be the patient will be in the prone position, and this will be the army crawl. So the patient I will do is the patient's affected leg, which will be this leg right here. And what I'll do is I'll put him in a figure 4 position first, and I will then take a towel for comfort and put it under the patient's anterior part of the knee here. And I will get as close to the joint line as possible. And I will do a mobilization glides there, 1 and 2 to control pain and edema, and 3 and 4 to increase range of motion. And after all that, I will check the patient, and it should decrease pain and increase functional activities and range of motion.